What is oppositional defiant disorder? Oppositional defiant disorder consists at least of 4 of the following symptoms lasting 6 months. It involves angry, irritable mood, which includes often being angry or resentful, easily losing temper, and being easily annoyed or touchy. There are defiant or argumentative symptoms, such as arguing against and defying authority figures, deliberately annoying others, and blaming others for their own misbehavior or mistakes. Oppositional defiant disordered individuals may also have been vindictive or spiteful at least twice in the past 6 months, or for in children younger than 5, these behaviors should occur for most days and on at least 6 months. Children older than 5 should exhibit this at least once per week for 6 months to be considered with oppositional defiant disorder. Also, the disturbance in between needs to be correlated with the distress of the individual or others in their immediate social context, or negative impact on occupational, educational, social, or other important functioning. The behaviors don't occur due to the presence of substance use, bipolar disorder, disruptive mood dysregulation disorder, depression, nor psychosis exclusively. In terms of specifiers, severity is based on the number of settings, such as, for example, mild oppositional defiant disorder is when it is in 1 setting, moderate oppositional defiant disorder is when it is in 2 settings, and severe is when it occurs in 3 or more settings. Oppositional defiant disorder is commonly comorbid with conduct disorder and ADHD and has been correlated with increased suicide attempt risk. 3.3% is the average prevalence rate. It affects more boys than girls on a ratio of 1.59 to 1 prior to adolescence. Oppositional defiant disorder tends to have its first onset occur between preschool and early adolescence, and it tends to precede childhood onset type conduct disorder. Despite this, most oppositional defiant disordered children do not develop conduct disorder. Argumentative, defiant, and vindictive symptoms increase the risk of bringing forward these symptoms into conduct disorder, whereas angry or irritable mood increase the risk of bringing these forward into anxiety and mood disorders. The onset of oppositional defiant disorder in childhood and adolescence increase the risk of adjustment problems, as well as the persistence of the oppositional defiant disorder and functional impairments in a lot of the following areas, such as having a more stressful workplace, lower education, relationship issues, impulse control problems, anxiety, depression, substance abuse, and antisocial behavior. One must consider the difference between oppositional defiant disorder and just an individual's personality. For some children, for example, may have temper tantrums 10% of the time. The frequency and intensity needs to be distinguished from the norm. Poor frustration tolerance and high emotional reactivity served as issues with emotional regulation, which was a prognostic temperamental factor. Bad child rearing practices can predict symptoms such as being inconsistent, harsh, or having many different caregivers. Oppositional defiant disorder are also at greater risk of being bullied and bullying others. There are also neurobiological markers such as reduced basal cortisol reactivity, low heart rate, increased skin conductance reactivity, abnormal amygdala, and prefrontal cortex were associated with the angry symptoms and irritability in oppositional defiant disorder. A meta-analysis in middle childhood revealed that more boys than girls had oppositional defiant disorder in the West, whereas the prevalence was similar in both genders for non-Western cultures. But refugees and first-generation migrants had a decreased risk of developing oppositional defiant disorder. Harsh parenting was an increased risk factor for oppositional defiant disorder in girls, but not boys. Oppositional defiant disordered individuals had constant or frequent conflicts with teachers, parents, peers, supervisors, and romantic partners. Regarding conduct disorder, individuals with oppositional defiant disorder is usually less severe and they would not exhibit unwanted aggression to animals, people, property destruction, or a pattern of deceit or theft. Oppositional defiant disordered individuals, however, had equivalent or greater impairment than conduct disorder due to issues of emotional regulation, such as, for example, an irritable mood and anger. Oppositional defiant disorder was more likely to be comorbid with ADHD, major depression, anxiety disorders, and disruptive mood dysregulation. So that's oppositional defiant disorder in a nutshell. Thank you very much for watching. Bye-bye.